So yeah, all these children have been one of the first ones that said, boy of 1 dies after doctors ignored sepsis signs and told parents they were the professionals. It's very important for us as nurses and doctors to listen to families, so listen to parents, because they know their children really well, so they can pick up on anything that's abnormal or not like their usual self. So it's a family-centered care, so all members are involved. Next slide, please. So in the next slide, as I am a paediatric nurse, in the next slide, I've just put some information about sepsis in paediatrics. So sepsis is the leading cause of mortality among children worldwide. 1.2 million children suffer with sepsis globally each year. And in the USA, 72,000 children are hospitalized for sepsis with a 25% mortality rate. 49% of children that develop sepsis have diagnosed comorbidities, for example, chronic lung disease, congenital heart disease, neuromuscular disease as well. Next slide, please. So in the next slide, what I've done is I've looked at some of sepsis and some of the symptoms that we might see. So there's 3 stages of sepsis. So sepsis, severe sepsis, and septic shock. So sepsis includes the fever above 38 or a low temperature, so below 36 Celsius, an increased heart rate, increased breathing rate, and also there's usually a likely cause of infection. So we know that the child might have an infection, or for example, children with chickenpox as well. So chickenpox children we've seen a lot, they've got really unwell with sepsis as well, because their scabs, their scars get really infected and they develop sepsis from that. So severe sepsis occurs when there's organ failure, so decreased urination, changes in mental ability. There's also problems breathing, and that will lead on to the child needing high flow oxygen, or also maybe a ventilator as well. Abnormal heart functions, and that's where we start looking at inotropes, so medications that will help the contract, how do I put it, but it helps with the functioning of the heart, so we might have to look at that as well, and I'll explain that later on. And extreme weakness as well. It's important to seek medical attention if you have any of the above symptoms. The earlier you seek treatment, the greater your chances are of survival. Oops, so sorry. Next slide, please. And I've also mentioned septic shock in the last one, sorry. So types of infection causes. As I mentioned before, children usually get sepsis sometimes if they've had chickenpox, because their scars get really infected. But some of any infection can trigger sepsis firstly, but the following types of infections are more likely to cause sepsis. So pneumonia, so sorry, 1 second. Sorry, pneumonia, we've got abdominal infections, kidney infections, bloodstream infections. As I mentioned before, the pathogens invade the body as bacteria, fungus, or a virus. I've also got here just some more information. So according to the National Institute of General Medicine, Medical Sciences, the number of sepsis cases increased every year. Possible reasons for the increase can be due to age, so the aging population, because sepsis is more common in seniors. And when I say seniors, people over 65 years old, and also minors as well, so children are highly at risk of developing sepsis. Next slide. Observations and diagnosis, sorry. So while the children are in hospital, so we like to do a systematic approach, so A, B, C, D, but also there's certain things that we have to make sure that we have. So which I'll go on to later, but we have to do a physical examinations, a full set of observations, including a blood pressure, capillary refill time, and also checking their GCS, their Glasgow Coma Scale. We also want to take blood samples, and we want to check all the following things which I've mentioned. A urine sample, a LP, a lumbar puncture, and take swabs as well. So as I've mentioned before about chickenpox, so you want to take swabs from the sites or any surgical wound site. You want to take swabs from that. Some of the children require chest drains, and these are for children with, so if you do have pneumonia, really bad pneumonia, you might need a chest drain. So PICC lines, PICC lines are a line, so a long line, enable you to give antibiotics or fluids, and it's more of a reliable source of, how do I put it? In order to get your fluids or antibiotics through a line, because sometimes with cannulas, which I know some people have had, if you go into A&E, you might get a cannula in your hand. They don't last very long, they only last a few days. So a PICC line is more for long term, and a PEG, which is a feeding tube that goes directly into the stomach. Around that site can also get infected as well. So any likely sites of infection or routes, we will take swabs from that as well. And I also said, we need to get so seeing a doctor, so you need a consultant to come and review the child as well. So one of the best tools currently available is actually just taking a set of observations. So keeping a track of the observations and seeing if there's any trends. So as soon as a child or anyone goes into A&E, they have an initial set of observations. And it's important to see if there's any changes in that. So if there's any decrease or increase in their heart rate, their blood pressure, their temperature. And that's where you can pick up of any deterioration. So regular recording of observations and assessment can help detect signs of its serious illness or deterioration. It also, so if a doctor can't, so when I go into, looking at the diagnosis and tests, if a doctor can't determine the source of infection with the above tests, which I've mentioned, they may need to, I just need to scroll down my screen. So they may need to order the following tests. So they might need to get X-rays to look at the lungs, a CT scan to view possible infections of the appendix, the pancreas, or the bowel area, ultrasounds to view infections in the gallbladder or ovaries, MRI scans as well to identify any soft tissue infections. And also we need to be aware of past medical history on the admission to hospital. So we need to check all of that as well. And as I mentioned earlier, parental concerns should always be taken into consideration, and trust your instincts. So if you believe that your child or your loved ones, they're not reacting the same, or they're not like how they usually are, any changes, is important to seek medical attention. Next slide, please. So the risk groups, I've mentioned before, although some people have a higher risk of infections, anyone can develop sepsis. So people who are at risk include young people, young children, seniors over 65, people with a weaker immune system. So people with a weaker immune system could be people with lupus, arthritis, so those taking steroids. It could be, weaker immune, such as those that have HIV or are on chemotherapy, so are cancer patients as well, or someone that has been in intensive care, or people that are exposed to invasive devices. So as I mentioned before about PICC lines in your pegs, those people as well. So intravenous catheters or breathing tubes. Those are our risk groups to look out for. Next. So what we have here is a UK screening tool, which we use in paediatrics quite a lot. And what I'm going to do is call our Sepsis 6 And it came around to avoid and, well, to prevent deterioration of our patients. So on the right hand side, I know it's really small, so you probably can't see all the information. So I'm going to go through Nate and explain all our sepsis and what it means and what we do. So this is our treatment for when children come into hospital, come into A&E straight away. So number one is high flow oxygen. It is important to give them high flow oxygen. It helps to move the oxygenated blood around the body. So high flow oxygen is our first thing what we give. Next, we take bloods and obtain IV access, as I mentioned before about a cannula, which you'll have in your hand, or usually in your hand, your wrist, your arm. So we get IV access first. That's very important. And we take blood. So we take bloods first. Next, which is very important, is you give IV antibiotics. I had a list before of some of the antibiotics we use, but I didn't think it was really needed for the slide. But I can mention some, like ceftriaxone is one of the first ones that we usually give as well. And ceftriaxone, there's many. There is a list of few, but ceftriaxone is one of the ones we regularly use. So give IV antibiotics. And each hour's delay in giving antibiotics, mortality rate increases by 7.6%. So within the first hour of your loved one or your child going into hospital, please make sure they get their IV antibiotics. Next, we usually give IV fluids, because as I mentioned before, they could be quite drained. They've got a low blood pressure, which is very important. They have a reduced capillary refill time, so that's a sign of dehydration, less than 3 seconds, so more than 3 seconds, I'm so sorry, more than 3 seconds, which is a sign of dehydration, so we'll give them IV fluids. And also ensure that they're seen by a senior doctor, so they're seen by one of the senior consultants to review them and start to make the process. And as I mentioned before, number 6 is consider inotropic support, which increases the strength of the muscular contraction of the heart. Usually fluids should help that. So if fluids haven't helped, you possibly need to give another, what we call fluid bolus. So a fast amount, we usually start with possibly 10 mils per kilogram. But you can go up to 30 mils per kilogram or even more. But the more fluids the child might require, probably likely that they need to be admitted to our pediatric intensive care unit and possibly needs intubation and ventilation if they need inotropic support, which I mentioned is about the heart. Other treatments other than intubation and ventilation, so being on a ventilator, is also something called ECMO, so extracorporeal membrane oxygenation tubes, which goes into the major artery. It just helps with giving the body or the organs oxygenated blood, and it's a life support machine for the children that we see. In adults, so I thought I'd just mention a little bit about adults. So I mentioned about people with diabetes, I think I might have mentioned that before, or with an increased blood pressure, or they're on increased medication. So we need to look into that as well to see if there needs to be any changes with their medication. Insulin, they might need insulin to stabilize their blood sugar, and this can be for children as well. Steroids to reduce inflammation, and painkillers. It's very important that our children are given, is given painkillers as well. So severe sepsis may also require large amounts. So in severe sepsis, people might require large amounts of fluids, which I mentioned before, and respiratory tubes for help with their breathing, and dialysis as well might be an option if the kidneys have been affected. Next slide, please. So recovery, I thought I would go into a little bit about recovery. So recovery depends on the severity of the condition, and if there's any pre-existing conditions that the individual might have. Many people who survive will recover completely. However, some will report lasting effects. And some of the lasting effects may be insomnia, some nightmares, still having joint pains, fatigue, poor concentration, lowered cognitive functioning, lowered self-esteem. So this is looking in adults, well, our teenagers as well. Severe cases of sepsis can lead to death. The UK Sepsis Trust says it can take up to 18 months before survivors start to feel like their normal self. So you can recover from sepsis, but as I said, you need to seek medical attention really quickly. You need to be getting your antibiotics within the first hour, and fluids and high flow oxygen if needs be, and you need to be seen by a senior consultant. So you can survive it. It just needs early medical intervention. Next slide. Oh, those are a few references. And I'm nearly finished. I hope I haven't gone too fast for everyone. So sepsis is the leading cause of mortality in children worldwide. Early recognition and management is crucial for improving outcomes. A systematic approach and senior review is paramount, as I mentioned before. So we need to look for our ABC, we need to do our sepsis 6, which I've mentioned before, and seen by a doctor. Some of the other information which I have, which I'll quickly mention, is sepsis can kill in 12 hours. So it's a bigger killer than heart attacks. That's what I've read. Heart attacks and cancer. I've also looked at some of the prevention, and some of the ones I've read and seen is vaccination, so flu jabs, so making sure you have the flu jabs for our senior citizens, good hygiene, proper wound care, hand washing and bathing is important. So good hand hygiene is important. And lastly, I'd like to say, so sepsis is a medical emergency. Every minute counts. Thank you very much.
Amen. Thank you so much. If you have any questions, please feel free to unmute, state your name and give your question.
No, any questions for me?
I don't think we've got any questions, which is great, which means you did a really great job. Just want to take this moment then. I'll just leave one more chance. If anybody has any questions, please unmute. Please unmute, state your name and give your comment.
Hi, it's Marlene.
Greetings.
Hello, Sister Marlene.
Yeah. When someone have strokes, are they high risk to sepsis?
So as I mentioned, anyone with a past medical underlying condition, and obviously with people with a stroke, you would have had, that's more in adults, but hopefully I can answer really well. Obviously children do have strokes, but it's more likely in adults. So there is a clot, and you would have had medication, or you would have had medical intervention. So medication or any intravenous medication. So I believe anyone that's had any pre-existing conditions is highly likely to develop sepsis. So yes, someone with a stroke is, I would say.
And can it be transferred person to person?
No. Oh no, so that's another thing what I want. So sepsis isn't contagious, but it can be spread through the bloodstream, but it isn't contagious. If you hug someone with sepsis, you're not gonna get sepsis.
Okay, thank you.
That's okay.
Sister Pam, Sister
Hello,
Samantha.
Sister Pam.
Hi,
Yeah.
praise the Lord. Once you have septicemia, is it and you recover, is it likely for you to are you more prone to redevelop it again?
Yes, you are. You are, and I did read it. Oh, sorry. I need to go back to my notes. But yes, you are likely, you can develop it again. And that's because you've required, as I've mentioned before, you've required, so that person's had been on antibiotics. They've been on several antibiotics. They've been in a hospital situation. So it could be acquired from the hospital. So they are likely to.
Okay, thank you. Yes, that's fine.
Sister
Thanks.
Jean.
Hello,
Sister
Sister
Jean.
Jean.
Bless you.
Hello.
This is Elder Carl's question, but he wouldn't ask himself.
Okay,
how do you recognize that you may have sepsis? How can you tell it separate from, say, flu symptoms or something like that?
So you would look at, so if you've had your flu jab, yes, you might have a little temperature, you might have some achy, like a little bit of a pain in your arm, but sepsis is completely different. As I've mentioned, having a high heart rate, having a high breathing rate, those things don't usually happen if you've had a flu jab. It's more localized pain in your arm, so localized pain in your arm and a possible temperature, but having a high heart rate, high respiratory rate, you've had an infection recently. So those are the symptoms I would pick up, and also just seek medical advice. So it's good to contact your GP, or you can go into your urgent care centre and just ask some advice, or call 111 and get some advice from them. But I would say high heart rate, and also I didn't mention before, like rashes as well. You could get tiny pinpoint reddish rash. I think there are some clear differences.
Thank you.
Sister Eileen here, Sister Samantha.
Hi, Sister Eileen.
It's just to piggyback on what you just said to Sister Jean. Can you hear me? I
can hear you, sorry.
Okay. With relation to the elderly, one of the signs you will find, especially if the elderly has pneumonia, is can become confused, and their urine will be diminished. If that's one of the classic signs for the elderly, so we need to be aware of that. Don't just say, "Oh, she's confused" or "he's confused." It could well be that there's sepsis on board.
Exactly, yeah. And I mentioned that before in some of the, when I went into severe sepsis, some of the things like not passing a lot of urine, that's something to watch out for. And that's why we would give a fluid bolus, so you'll have fluids as soon as you step into the hospital, to help with that as well, and a confused mental state as well. So those are all things to look out for. And seek medical advice. I think sometimes we don't, and we leave things and we think it's going to get better. But the more you leave sepsis, the more you leave all these signs of sepsis, it's a greater chance of mortality, unfortunately.